Hello, I'm Dr. Vandita Samavedi, an internal medicine physician, and I'm very excited to welcome our guest today, Dr. Pallavi Patel. She's a gastroenterologist. She's extremely loved and respected by her peers and her patients, and we are very lucky to have her in our segment, Haldi Living with Doctors. So, welcome, Pallavi. Thank you for coming.
Thank you for asking me, Vandita.
I have a question for you. People who are, let's say, cannot tolerate dairy, lactose intolerant, can they have yogurt?
Yeah, yogurt and a lot of cheeses that are cultured tend to be pretty well tolerated. And so some of the lactose sugar is broken down. With lactose intolerance, there's a spectrum. Some people will be very sensitive, and any exposure to dairy may trigger their bloating and cramping and diarrhea. But for others, they have a higher threshold. And generally, they will tolerate yogurt and cultured cheeses. So not like your Kraft singles, but like the ones that you get that are aged.
Sometimes when we go to stores, we see such wonderful supplements that heal everything. True or false, can supplements ever harm us?
Oh, for sure, especially with the liver. As far as your body's concerned, all these medicines, supplements, over-the-counter, herbal, they're all predominantly processed through the liver. So, some are not, but the majority are. There can be some that when they get metabolized can have a metabolite that is very hard on the liver, and it might be an immunoallergenic type reaction where it's your specific genetic makeup that causes it. And then there are other times where it's actually toxic to almost anybody that takes it. It's not true that just because you can obtain them over the counter that they're harmless. I agree with you on that.
One of the things we've noticed is a lot of youngsters, we are going towards processed foods. A lot of times we feel like, okay, when you're young, your liver can detoxify everything. But is that true? Do younger people also need to worry about metabolic diseases, diabetes, fatty liver, things like that?
No, absolutely. The number one cause of adult metabolic liver disease is childhood metabolic liver disease. And over the last 30, 40 years, as the weight management issues have come up for sure in American culture, that has led to coincidental metabolic liver disease, earlier onset of diabetes, and other consequences of metabolic syndrome.
So important, absolutely. I know you attended one of the liver seminars recently. Is there one pearl you could share from that? Or anything that comes to your mind?
Right now in the US, there's a huge burden of liver disease related to fatty liver, so metabolic liver disease, and also to alcoholic liver disease. And some patients share a combination of both metabolic and alcoholic liver disease. It's called MET-ALD. Patients are chronically asking, what's the best way to manage my health? Alcohol in moderation, meaning no more than one alcoholic beverage a day, preferably not every day. For a woman, women and men metabolize differently, and for a man, very similar, 1 to maybe 2, but not really 2 even a day would be ideal. So that's one, to moderate the alcohol use. And then the second is to have more of a healthy diet. So the Mediterranean diet has always been a popular diet, and right now, especially for metabolic liver disease, it's a very popular diet that's still recommended. Of course, the second pillar is exercise. So being active in addition to watching your diet, that combination works the best. And so the Mediterranean diet, having more fruits and vegetables, like just having more colors of fruits and vegetables, using olive oil, limiting your red meat intake, more on the fish and white meat, limiting your alcohol intake, more focused on legumes or other carbs, plant-based proteins, and then focused on more of the carbs, whether it's the pastas or complex carbs, complex carbohydrates. So that is actually the most recommended diets for metabolic liver disease.
Very nice. Yes, very true. Thank you for sharing that.